Well, I think we might get started then. Hello, everybody, and welcome to our PCC4U Community Educator webinar, I should say. It's lovely to have you with us. Hope you all had a lovely Easter break. We are hosting today's webinar from the unceded lands of the Turrbal and Yagara people in Meanjin, Brisbane at QUT. And we want to just start our session today by showing you this acknowledgement to country.
QUT acknowledges the First Nations owners of the lands on where we gather today and pay our respects to the elders, laws, customs and creation spirits of this country. For thousands of years, the First Nations owners have gathered to share their knowledge and stories. We pay our respects to all Aboriginal and Torres Strait Islander peoples and acknowledge the important role they play within our communities. We recognise their long and continuing connection to country, the lands, winds and waters throughout Australia. We recognise that these lands have always been places of teaching, researching and learning.
Thank you. And as we do each time, we just wanted to give you an opportunity to make your acknowledgement to country as well. And if you want to do that by just introducing yourself in the chat and mentioning the lands that you're working or living on today as well, that would be great. While you're doing that, I just wanted to introduce to you the PCC4U project team who's here on the webinar today. My name's Sharon Wetzig. I'm one of the Learning and Development Coordinators working across PCC4U and the IPEPA project. And with me today in the busy seat is Karen Wynne, who is one of my counterpart in Learning and Development Coordination. And we are also joined by the lovely Kylie Ash, who is the project manager for PCC4U. So welcome everybody. It's nice to have you join us. We're going to get started on our topic presentation today, which is on the Enrolled Nurse Toolkit resources. And I'm going to hand over to Kylie. Thanks, Kylie.
Thank you very much, Sharon, and welcome to everyone today. So I would also like to thank everyone for joining us today as we provide an overview of the EN Toolkit resources, version 1 and 2, and also share some tips and hints around teaching this content, because we know that it at times brings some challenges. But before I start, I just wanted to provide a bit of a background to the PCC4U project for some of you who may not know PCC4U so well. PCC4U aims to improve the knowledge and confidence of the health workforce to support people with palliative care needs. And we are funded by the Australian Government Department of Health to do this. And we provide learning resources to integrate this palliative care knowledge into health undergraduate and some postgraduate education programs. And we started in the university sector a number of years ago, and this has extended into the vet sector with the toolkits in recent years. And all of this work is based on extensive research and consultation in the very early stages of the PCC4U project. And this can be explored further if you'd like to know more in our key publication principles for including palliative care in undergraduate curricula. So to introduce the EN Toolkit, I'm just going to play a very short video which just captures some of the key elements of this resource.
Designing a course to meet the requirements of a unit of competency is challenging. Imagine a solution that's free, developed and maintained by subject matter experts, has ongoing implementation support based on contemporary evidence and mapped for you. For the unit of competency, provide end-of-life care and a palliative approach in nursing practice, Release 2, the hard work is done. Introducing the PCC4U Enrolled Nurse Toolkit, an online palliative care resource designed specifically for the vocational education and training sector. The PCC4U solution is a bespoke learning and teaching resource reflecting Australian standards and work practices. Encouraging active learning, the Enrolled Nurse Toolkit is designed to ensure work-ready graduates. Our resources can be easily adapted and contextualised to fit your student cohort, location or organisation, and are designed for face-to-face, online or blended learning. Contact the PCC4U team to start implementing the Enrolled Nurse Toolkit today.
There you go. So just to summarise, PCC4U provides the suite of Enrolled Nurse Toolkit resources at no cost. Our team works with registered training organisation educators and managers to introduce and support the use of the toolkit. You can see there on the screen the education resources that are provided, either by hard copy resources, or we can give you access to the e-learning resources as well. So there may be some confusion over the number of versions that we have at the moment, and hopefully after today's session there'll be a bit more clarity. So yes, there are 3 versions at the moment. We have closed version 1 though. We found that there was feedback in the initial stages when it was released in 2018. The content was relevant, it's evidence-based and engaging in a self-directed format. However, the potential for educators to deliver the content was actually constrained by some of the force function settings and sequential audio narration. So there was some frustration for users and potentially some limited usability in face-to-face and online facilitated teaching. Version 2 was similarly mapped to HLT ENN 010, and it's the program that most people are using today. It was based on the original version 1 content, but it redeveloped into Articulate Rise, providing a much cleaner, more contemporary version of e-learning to support more flexible delivery. It is still currently available via our learning management system, and you can see there we're having that open until the teach out period, and that's looking like December 2023. With the updated training package last year being released and the new packaging rules, we have a new unit of competency in palliative care, HLT ENN 068, and that was released in mid-2021 as a core unit of competency. So version 3 has been redeveloped and mapped to the updated unit of competency, and I'll discuss later sort of some of the changes that have been put in place for that one. And at the moment, we just have that available to educators on request in our learning management system. So I'd like to extend a big thanks to those sites who are already using the PCC4U resource. This slide shows our current implementation rates. We report this data back to the Australian Government Department of Health as a condition of our funding. So you can see there we currently have 2/3 of all RTOs delivering the Enrolled Nurse Training Package, actually delivering the Enrolled Nurse Toolkit. We also survey educators to get more in-depth information about implementation. RTO contacts are invited each year to participate in an academic survey, and this is some of the results from late 2022 that I just thought I'd provide some feedback on. The responses give us a sense of where and how the content is included in the training. As you can see, it's quite varied. We do get examples at times, though, of novel implementation. We had an example of students visiting a crematorium as one example for implementation of some of the palliative care content. And it also provides some feedback and insights into some of the challenges which are impacting inclusion of this content, which I can then specifically work with sites to support solutions for some of these. For example, some of the clinical placement discussions, we work with sites to see that perhaps a palliative care experience can be also gained within an acute care setting or an aged care setting. Educators also identified some of the strengths of using the PCC4U resources, which is always great to hear, the realistic, easy to understand, up-to-date content and it's in line with current practice. increased knowledge and preparation of students for their clinical experience was great to hear. And you can also see some elements of the toolkit which were valued as well. Feedback was around maintaining the accessibility of the resources and updates of the resource, which is a priority, creating new resources for other qualifications, slightly out of scope at the moment, but certainly we take all of that feedback on board and it may inform our future funding, so it's much appreciated. The need for more information on voluntary assisted dying, legislation and palliative care in primary care settings was also highlighted. And I believe the updates to the new unit of competency and version 3 will address these deficits. And I'll highlight those when I summarise these in a moment. But first of all, I had the honour of meeting with Melissa Slattery, who's Academic Director at Equals International. And we'll just play a recorded interview where Mel provided some feedback on the experience at Equals International on delivering the Enrolled Nurse Toolkit.
Welcome, Mel. Thank you very much for joining us this afternoon.
Thanks so much, Carmen.
So Equals International were a very early implementer of the EN Toolkit. Personally, thank you for your support of this work. Can you tell me why you jumped on board so early, right from the start with the EN Toolkit?
I think a lot of it was about timing. In 2018, Equals was undertaking a lot of industry consultation with our industry partners about what they were seeing in the new workforce of graduates, both Certificate 3 in individual support and also nursing graduates, and what they were experiencing in the workplace. And one of the things that came up, particularly in the context of aged care, was confidence around palliative care and providing palliative care in a way that was meaningful to the individual patient, but also caring for families and dealing with complex situations. And so when the EN Toolkit became available and we looked at the resource and shared that within our team, it seemed like a really practical way that we could improve palliative care education at Equals.
Excellent, because at the time it was an elective, wasn't it?
Yeah, that's right.
So that was actually quite a big decision. I mean, when we first started, there was really only probably about 15-20% of programs that were engaged and implementing that training package or the unit of competency.
And I think that's where that industry consultation remains so important when we're looking at new courses or redeveloping courses, making sure that we're consulting industry, because ultimately we want to ensure that our students are highly employable. And palliative care is recognised to be a task or a competency that's associated with those roles. And it's such an important part of those roles. And I think that's what industry recognises. So as an education provider, we have to recognise that and implement that too. It's really important.
Excellent. So then once you've picked up the EN Toolkit, how did you find the educators actually responded to the resource?
So I think the wonderful thing about the implementation of the toolkit was the support that we received from yourself and the palliative care curriculum for undergraduates in its actual implementation. Because I think when we first looked at the toolkit, there were lots of questions about, am I capable of actually delivering this standard of content? Being such a specialised area of nursing and care work. Certainly people want to have that opportunity and that platform to be able to ask questions and have them answered by people who are expert in the field. So I think the support from PCC4U was one of the main components to it actually being implemented successfully. But I think the other thing that led to our educators being so comfortable with the resources was the variety in the toolkit. So having the access to the videos and then the supportive content, that's what made the difference in actually using it in the classroom setting.
So that leads me to my next question actually. What are some of the teaching strategies that they've actually found have been quite effective?
So I think it's been really important to scaffold that education and ensure that we're breaking it up into small areas of theory and then supporting it with video content. Something that we have found particularly important with the delivery of the palliative care curriculum in both our Diploma of Nursing and Certificate 3 in individual support is ensuring that we've got counselling support available, because we know that those units of competency can be quite triggering for students and can be quite unexpectedly triggering, but they can also be triggering for educators. We know particularly in the last couple of years with coronavirus, there's been more incidences of students who have experienced a family member's passing whilst they've been actively studying, and border closures have impacted the ability for people to travel. So having our counsellors involved, having our mental health first aiders involved has been really important to ensure that when we're teaching those units, we're able to do it effectively using the toolkit, but also in a manner that's really supporting our students through content, which can be quite confronting.
Definitely. So in terms of that confrontation that the students may feel and experience, was there anything else? I mean, how else have they responded to, once you get past some of those barriers, I guess, or concerns? Have they enjoyed the content, or have they responded otherwise?
I think in terms of the content itself, I think the wonderful thing about it debunked a lot of myths or preconceived ideas that students might have had about what palliative care is and how it will impact their work role and what their responsibilities are. So in terms of the actual toolkit itself, I think being able to view the videos and hear some experiences that are very realistic has sort of prepared them better for when they're going out onto work integrated learning experiences and triggering some of those questions early on. So what we actually saw when we surveyed our students after the implementation of the toolkit was a significant increase in confidence overall when it comes to actually, what does this mean for me as a future enrolled nurse or a future care worker?
Thanks, Mel. That is fantastic feedback around the student experience. Could you tell me, have you had any feedback from industry? Have employers noticed a difference in graduating enrolled nurses?
That's really quite an interesting question, because this started with industry consultation for us, and certainly industry consultation since its implementation that our students, when they have graduated, have been more work ready to actually care for people who are experiencing palliative care, regardless of what phase of palliative care that is. So we've seen increased confidence with terminal care, which to us was one of the things that we wanted to achieve. I think one of the sort of light bulb moments that we had was when industry started asking how are you delivering your palliative care training, what's different, because they noticed and they were trying to figure out what we were doing differently, and their own interest in actually picking up the palliative care curriculum to use in the workplace at a different angle. So that's been really, that's a wonderful thing as well to use on the postgrad scenario.
Yeah. Oh, that's fantastic. All right. Well, thank you very much for your time today.
Thanks so much, Kylie.
Thank you very much. That was a fantastic time that we had up in the Sunshine Coast with us, the birds in the backgrounds there. So I hope that didn't affect your audio experience, but we felt it was quite nice to be outside when we met up. So you've heard a little bit about, I've spoken about our program and the Enrolled Nurse Toolkit, and we've heard from Melissa with their implementation. Thought now we might just get a little bit of feedback from yourselves and understand your experience with the Enrolled Nurse Toolkit. So Sharon's going to run a bit of a Padlet activity there.
Yeah, thanks, Kylie. And I applaud your very COVID-safe interview session. That was good to see the wind blowing through. Yeah, Karen's just sharing a link in the chat now to this Padlet, which we've set up just to hear a little bit from you about how you use the EN Toolkit or other PCC4U resources in your EN education. So for those of you who haven't used Padlet before, it's a digital collaboration website or board that is meant to be like a pinboard or a whiteboard. And you can interact with it by just, if you wanted to say, write a comment about your experience of using the EN Toolkit, you just click into that little comment section and type away, essentially. And then if you wanted to answer the other questions, just the same, add a comment that way. So we might just give you a few minutes to do that. You have a comment there.
Sorry, that was me, Lise from TAFE. Hi.
Lise, wonderful.
Yeah. So I was just typing into the Padlet, but I wasn't sure what we were supposed to be doing. Sorry.
Yes, you've done it exactly right. Well done.
Oh, you want us to use the Padlet?
Yes.
Okay.
Absolutely.
All right. No worries. Okay.
So yeah, you've said you've embedded it into your LMS and played the videos in class and discuss each case study. Do you want to give us a little bit of information, Lise, while other people are getting in there, about which of the videos, which case study videos, the ones in the toolkit, or do you use other?
We have them all. So we have several topics in our unit in Connect, and there are 6 topics for the unit of competency, as you know, and they're all embedded in our Connect LMS. And so we have Tom in week 1, and then we go to Michelle for week 2, and gosh, I'm trying to think, Herbert and Betty and gosh, I've gone blank right this second.
Emily, the little girl.
No, we don't use Emily.
William.
We have William. Yeah, our assessments that we run, we have 2 written assessments. In fact, we used to have 1 written assessment and 1 practical, but we've changed the practical to another written because it just works better for us. And in our first assessment, there are questions that relate to William's case study, Michelle's case study, Betty of the focus module, Tom. I think there's a question about Tom. And I can't remember, I've just gone blank with who else there is. And our second assessment is actually based on videos that you don't see in the actual modules, but they're somewhere within PCC4U, and it always evades me slightly as to where. And that is the case of the guy with the Whipple's procedure, and for the life of me, I'm trying to think of his name. Hang on a minute.
Be one of our.
That's Jeff Holder.
It's Jeff Holder. Yes, it is. That's right. It's Jeff Holder. So yeah, he forms the basis of our second assessment. Yeah.
So I think, Lisa, you use a lot of the core module sort of elements as well. I'm not sure that you're purely using the Enrolled Nurse Toolkit.
No, we use a combination of the core modules and the focus modules. Yeah. So we don't use the actual toolkit as such. I wish we did, but we don't currently. So new training package coming, who knows?
Yeah.
Exactly.
That's great. Thank you.
But I think that speaks to the flexibility of the resources as well, that they can be used so flexibly. We have packaged them up for the Enrolled Nurse Toolkit, but as you can see, we've got a range of resources. And, you know, Lisa, you guys have done very well in doing that cherry picking, but just to flag that that's what we are also here to do, that if you've got specific learning outcomes or a specific case scenario that you'd like to explore, that's what the PCC4U team can do, is sit with you and actually go through our very wide range of resources.
Just so you know, anyone else listening to, the Jeff Holder videos that Lise mentioned are a part of our simulation module. So they're on our learning management system, accessing via the simulation resources. So that's where you've got those from.
Yeah.
And thanks to those other people who've put some comments into the Padlet there. I can see that people said it's easy to use, well set out with clear scaffolding. And in terms of barriers or challenges that you might have experienced, a limited experience in undergraduate education, had to learn by modelling from those around me. I think many of us in education, particularly in healthcare, we know exactly how you feel. So we've been there and done that as well. So we hope part of our role as PCC4U project team is to support educators in implementing our resources, and we hope to be able to give you some learning and teaching strategies along the way, particularly with regard to palliative care content. So thanks for your involvement in that, and I will just hand back over to Kylie, who's got some more information on the the new version of the EN Toolkit.
Yeah, so it sounds like this is going to be new to some people in the room here. So version 3, with significant new material has been included within our Enrolled Nurse Toolkit V3. The major differences in performance criteria and the knowledge evidence that needed further development to meet the needs of this new unit of competency really are around those points that I've listed on the slide there. It was around identifying end-of-life care needs for those with cognitive decline and mental health impairment, assessment of delirium, voluntary assisted dying, and digital tools used to support palliative care in aged care settings. As a quality process, though, when we did this redevelopment, with the additional content and further mapping to the new unit of competency, we circulated the resources for peer review. These subject matter experts provided extensive feedback and really looked at it from the point of view of, was it relevant for industry? Were the cognitive levels for the audience appropriate, and did it meet the requirements of this updated unit of competency and teaching package? We also listened to the feedback that we were getting around the number of certificates. So there was a frustration that we only had single certificates in version 1, and these were multiples then being submitted for your requirements for assessment. So we've now got a single certificate of participation, and that's following through to version 3 to address this feedback and really ensuring an easier process to record student participation in the toolkit as well. So just some housekeeping, essentially. Where can you actually access the EN Toolkit? This is a screenshot of our website. So you can actually go onto the website www.pcc4u.org.au and access it via the top right-hand side there. It goes directly to the palliative care learning management system. And you can also go in via the For Educators tab, which you can see there on the left, and access information, resources for educators, the implementation guides, and access to the videos. And if you just have a squiz of the snail trail at the top there, so you've got the For Educators, click on the Registered Training Organisation panel, and then you can see they're listed all the resources, and they're all hyperlinked off to pages where you can access more information. Alternatively, you can go directly to our learning management system. After a short registration process, you can access the e-learning resources via the Palliative Care Education LMS. We share this LMS with 2 other project partners, and you just need to click on the Palliative Care Curriculum for Undergraduates link and then choose the appropriate resources that are all listed. In particular, the Educator Community Hub is one that I recommend for all RTO educators. It's a portal where you can access and download resources to support your teaching. You can also find the webinar resources. So you can see there, if you click on that link, you can find the webinar recordings, any of the PowerPoint presentations and other interesting readings that we've had each month. You can also find these downloadable resources. So the curriculum blueprint, if you're not familiar with that, is just it's a snapshot of the toolkit topics. It's got the learning, the overview, the aims and objectives, and then some of the content outlines. The implementation guide, if you're not familiar with it, it has all of the unit mapping to the elements and performance criteria for the unit of competency, and also to the enrolled nurse standards for practice. And then it also has information, so you can use it as a real teaching guide. It's got all of the content written out there and some suggested responses to some of the thinking points as well. Of course, the EN Toolkit e-learning sessions are also available on our learning management system. And if you have a chance to look at them, I think you'd agree that version 2 is much more engaging and easier to use now that it's been built in Articulate Rise, and you'll have a similar experience in version 3. The case study scenarios, which Lisa, you were mentioning before, these are all embedded throughout the EN Toolkit and really provide a rich learning opportunities and engagement for students, to the point where sometimes our main complaint is that perhaps they're too engaging and the students get too emotionally involved or engaged with the actual case scenarios. But I will just stop there though and sort of see if there's any questions at this point in time, and just to say we're available as well. So I'll stop sharing, Sharon.
Not a question, but a comment, if I might.
Certainly.
Just for some feedback for you. Of the different case studies that you just popped up on the screen, repeatedly I find with my students that Michelle is the most confronting, and we offer students to attend classes via one of two ways, and that's face-to-face or via virtual delivery through Zoom. I mostly find my students for this unit want to partake at home over Zoom. And a lot of the time is because of the emotional responses that Michelle particularly evokes, and people like to feel safe in their own environment with a box of tissues on hand, if I can put it that way. Yes. The others are sad too, but Michelle is the one that every single time evokes really emotive responses from people.
Yeah. Yes, we've certainly heard that before, and we acknowledge that. It is a young person with children, and certainly it does evoke some responses. And what you've described around the students perhaps experiencing it in a safe environment from home is something we have also heard before. And Sharon's going to actually bring together some tips and hints that we've learnt along the way with some of our webinars last year. And despite that, some of the feedback from educators is that it was the students felt safer, so they were actually more engaged in the conversations and felt like they could contribute to some of the conversations a bit more when they were in that
100%. Yeah. I get much more class participation when they're at home feeling comfortable. Yeah, absolutely.
Yeah, no, it's great feedback. Excellent. Great comment. Mm-hmm.
Yeah, thanks, Liz. And also just to mention, we had the Tom story video up there with our redevelopment of our Focus Topic 2 resource. We've actually edited those original case study videos to include some expert commentary from two of our Indigenous project people. So it's well worth having a look at that, and it just provides moments in the video to pause and reflect and consider how the interaction perhaps could be improved, and what's kind of going on behind the scenes there. So that might be something you can look at as well. Great, good discussion there. It's really interesting to hear people's experiences of implementing the toolkit. We might just shift gears slightly, and we're going to have a little bit of time just looking at some learning and teaching strategies in palliative care, and we will link those back to the toolkit, of course. So this is something that, as Kylie said before, we have learned a little bit about through doing our Educator series last year. So we're just going to do a sort of a quick tour of these things today. And some of the, I guess, principles that we're working from is that we know we have adult learners who want our learning to be relevant and real life and interesting and fun and connected to what they already know. We know we need to provide active learning because attention spans are, especially in an online context, are around about the 5 to 10 minute mark. So we don't keep people's engagement much longer than that unless we have some active learning for them to be part of. We know that people learn well in a collaborative setting, so learning from each other, that peer-to-peer learning and engagement is a really big part of learning. And as we've already mentioned as well, we want to make sure that people are safe, and we know that learning palliative care content can be very personal and bring about some strong emotions. So it is important to be able to build trust within the group for that. One of the things that we do, we have a range of different introduction activity options, and we just have these kind of summarised on one of our Padlets. There will be a link to this in the LMS webinar resources, so you can find it and have a closer look. But we just wanted to take a couple of minutes and do one of the activities that's called the D word or that word. We know that in the English language, there's over 200 euphemisms for the word death or dying. And we know that there's some fairly creative ones that have come up. So you might have heard some interesting expressions when we just really can't say the word. So this is a good way you can engage with your students in just kind of gathering that information. So if you're comfortable to do that today, you want to just write on this this slide. If you go to your Zoom tools and use the little annotate button, which is the pencil icon, if you click on that and then go find the capital T for text And then you can click that and then type anywhere on this page and include some of the words or phrases that you've heard. And we're just going to put a few on there to demonstrate how it's done. So feel free to just interact with that. You can, of course, write with the freehand drawing tool, but that tends to be quite messy. So there's lots of different words that we use: passing on, passing away, kick the bucket. We often hear clinicians say things like going downhill, which can be a bit ambiguous to some family members. So that's just one way that you can, I guess, get some interaction with your students in a fairly low level, like non-confrontational way, but it might spark some conversations and discussions about what they've heard and what they might say. We might just save that one and move on, because I know we're moving on with time. And another thing that we recommend is that you provide a content or trigger warning right up front when you're going to be covering this kind of content. This is just an example, but you might be able to just provide a warning to your students and then give them some tools of support services, and include what your local support services are as well with your organisation. Another strategy that you can use is to allow students to determine how deep they want to go with this kind of content. So we know that students have different levels of comfort based on their past experience or their current experience of perhaps family members and friends who are experiencing life-limiting illness or death. If you enable student-led engagement, it gives you the right depth of learning for each person, and ultimately that will be all they can take or handle anyway. Providing a range of activities helps with this, giving them different options for ways to be involved. And as we talked about before, we've heard that people are generally more comfortable in online environments, and encouraging students in those online environments to support each other. So to be positive and encouraging when other people are willing to share their experience or their stories. Checking in regularly with your students to see if they're okay. So we provide that warning up front that this might be sensitive or triggering content, and then regularly checking in to see how people are going and reiterating the supports that are available. And I think a big part of it is normalizing that this is sensitive and upsetting content. And Lise, your experience is one we've heard a lot of with people, especially with Michelle's story. And I know the first time I watched it, I had a box of tissues beside me as well. So I think it's good to just share that with your students, that it's normal to be upset by this kind of content. It means you're human. And finally, in terms of the safe environment, we encourage you to practice self-care so that you can model that to your students. So talk about the ways that you look after yourself, and definitely point them towards the self-care resources that are part of the PCC4U curriculum. We also wanted to just give a little piece about some technology and how we use technology to engage learners. And you've had a little bit of a taste of that with some of the activities we've done just now. So I'll just whip through this, and then we can have some questions if you've got questions about certain things. So some of the ways we have used this in our webinars in terms of providing a variety of ways for people to engage. So you can use the chat functions that are part of your Zoom or your whatever platform you're using. There's a lot of interaction possibilities there. You can use the chat, and you can use the Zoom polling function as well. So that's just different ways to give people opportunities to interact. And with that attention span of 5-ish minutes, it's really good to plan something like this, even if it's just a tick or a cross or a thumbs up. Let us know if you're still awake kind of interaction every so often through the session is really helpful. We have some strategies to get people thinking about what they're learning. One of those you might be familiar with is the think, pair and share. So you think about the answer to a question, you pair with one or two others, and then you might share it with the broader group. Develop a quiz question is a technique where you can ask people to think back of what you've covered in the last 10-15 minutes, and for them to write their own quiz question about the material, and then they can put that to the rest of the student cohort as well to see, well, it will help you gauge how much they understand of the content, and also helps to kind of see who's following along and who may have drifted off. Something to do when you're, particularly when you're watching videos, or videos are part of the content, before you play the video, get people to look out for something in particular. So if you set them up with a task, like watch the way that Michelle interacts with the CNC in this, or vice versa, then that will get them some purpose in watching and looking for a particular thing when they're watching. Making a list is also a good thing to do when they have to read a resource or looking at videos. Write down all the things you observed about body language in this interaction, for example. And then make a word cloud. That's a good way of getting people involved, either whether it's in a face-to-face setting or online. You can use lots of different techniques to get people's feedback. Ask for contributions. So we want to hear what people are thinking or their experience. So as we did just before, we did an annotation of a slide. You can also use the whiteboard on your video conference platform. This is an example of an annotation as well. So we just put some things on the slide already, and people could vote on which they thought was more important. Other ways you can get interaction and contributions are through Padlet, which you've seen as well. And there's another platform we have used as well called Jamboard, which is a Google-based platform. Encouraging networking and collaboration, you can use breakout rooms or in a face-to-face setting, the small group activities. Often find that small groups, 3 to 5, really have a much better chance of taking on a task and sticking with it, then and get everyone participating. So that's, I guess, a really brief tour of some of the strategies. We'll put that presentation up on our learning management system if there's any ideas or concepts you want to look at in a bit more detail. So just the last activity that we have is an example of another Padlet board, which Karen's just going to pop the link in the chat there. We've taken a session 4.5 from the EN Toolkit, which is on pain assessment and management. And I'll stop the slide sharing and just show you the actual Padlet. So this one we're not asking you to comment on or interact with just at the moment, so you can relax. So we've taken the content essentially out of this session 4.5 and put it into a Padlet form. So I don't know if any of you are currently using Padlet. You can get a free subscription to it, which allows you to have 3 walls at a time. Or if you get an organizational subscription, it's not overly expensive. So worth just signing up. If you think this is something you might like to use, you can always get a free account and see how you like it. If you do use Padlet and you want this one or other Padlets that we've shared and used in our other webinars, then let us know. We can easily give you the link to make this and make it your own, essentially. So what we've asked people to do here, what we've shown them is this is the objective for the session. This is what we want them to be able to do at the end of the session. The resources for this come from our simulation resource, which is that e-learning scenario that we were talking about earlier. And these are the tasks we want them to do. So they've had a new patient admitted to their ward. First thing to start with is watch the handover video and read through the clinical documents and handover notes. So they can follow along here and go and do those tasks. There is a printed transcript of the handover video, and we've just uploaded it here as a image. So the students can actually have this, download it and do their task of highlighting or underlining. They can do it electronically and then share it in a breakout room if you're doing this remotely. Otherwise, you can have printed copies of the transcript that you can hand out to your students to use to do this little activity. So what we want them to do is we're getting them to highlight or list the physical and psychosocial factors that are relevant for pain assessment. And then we want them to list or highlight the objective and subjective information. And then think about or talk about maybe how easy it was to determine whether the information was objective or subjective and why. Students can make comments too on each of these posts, and we're going to get to that a little bit more when they start looking at the videos. But the little comment bubble there, as you've experienced in the first Padlet, then it is the way to do that. So we've had the handover. The next part is to assess his pain. So we've got 2 example videos in our simulation resources, and these are linked out of the EN Toolkit. So students don't have to go and register for the simulation scenario. They can just get a link to those videos straight from the EN Toolkit resource. So they first watch the video that doesn't meet the learning objectives, and they've got an opportunity to think, reflect and respond based on these couple of questions. So if students are interacting with this in an online learning scenario, they can add a comment here. Do you think the healthcare workers handled the situation well? Yes, they did. That was great, blah, blah. If you've got a group together and you wanted to use this resource, you can get a Padlet interface on your phone very easily, and you can have students responding and adding their comments in a Padlet, which you can be displaying live on your screen. That sometimes can be quite helpful because students are maybe more willing to engage via a Padlet than they would be to talk about it in front of the class. So that's just another way to do it. Once they've done that video and the reflection questions, then the second video is the one that does meet learning objectives. And again, we've got some points there for them to reflect on, which are basically just taken from the resource, from the thinking points as part of the resource.
And
so
I think,
Sharon,
if you couldn't use Padlet, there are other options potentially. I think Padlet's the nicer of them, isn't it? It's quite neat and it flows nicely. Jamboard is also a potential open access one that could be used. Yeah. But it's just not quite as neat and tidy as the comments, the way the comments flow with Padlet, is it?
Yeah, and that's right. We've had the example that Bernie talked about. VoiceThread was another platform that she's used to incorporate PCC4U learning materials and get students to answer questions either in a synchronous session or an asynchronous environment as well. So just aware that I've talked too much and out of time, so I might leave it there, but definitely email us if you have any questions about those resources, and I'll hand back over to Kylie.
Thanks, Sharon. I think I should be sharing there now. Look, just really wanted to wrap this up. I understand that we're almost there at the end now. So I think hopefully you will have some appreciation now of the resources in the EN Toolkit that we have available. Currently both version 2 and 3, 3 on request for the 2 units of competency that are currently being used. We acknowledge that it is a challenging content area to teach. I have an amazing team though with our learning and development coordinators who are able to support your education needs as well though. So keep at it and use some of the resources that we've got and the learnings that we have developed over the years of speaking with other educators. And if you do need some support to implement and use the EN Toolkit and other resources, more than happy to follow up with anyone individually as well. So that's just a little bit of a summary. We might just, if you've got time, we'll pop up a poll, and if you want to give us any feedback on today's session. And while that is up, I'll just briefly summarise. So to get any of the recordings for this session, you can go on to the PCC4U Educator Community Hub. Just need to log in and access that Educator Community Hub and then enroll in the 2022 webinars. And you're able to access all the previous webinars that we've had as well over time. So thank you very much for that. Our next webinar is in May, and I think Karen was going to give us a little summary blurb on that.
Yes, thank you. Hope everyone can hear me okay. I'm just, my name's Karen, as Kylie was mentioning, and I'm really looking forward to delivering the next webinar based on simulation. So it'll be the first of 2 webinars that relate to simulation across this year. And this one will focus very much on if you're a beginner educator wanting to embed simulation, or if you're already an educator who uses simulation, but you'd like to look at your current skills or how to support your participants or students, or also how to grow your own skills. I've done simulation over 15 to 20 years and I've still got so much to learn myself, and I have learnt so much in that past time as well. So there's a lot of research out there about simulation. There's some really excellent speakers that we'll have coming in. So that'll be Stephanie Barwick, who is the Director of Simulation Innovation for Mater Education, and Dr. Jenny Rudolph, who is the Executive Director at the Centre for Medical Simulation in Boston. So it'll be some interesting Q&A sessions with both of them. With Stephanie, we'll focus on the student perspective and how best to psychologically support participants. And with Jenny, we'll be looking at how to focus improving your own faculty skills, or the skills of your faculty who would be delivering simulation. So I hope that you enjoy that. I'm looking forward to delivering it, and it will correlate with the soft launch of a simulation guide that will support educators. So for new beginners to simulation, or people who already have an understanding of simulation as well. So that will be coming up in May. So thank you, Kylie.
Excellent. That should be a really good session to run. And we know that a lot of the resources are being used for sim. So that's great. So thank you very much, everyone, for your time. Apologies, we've gone over a couple minutes. But yeah, get in touch if you need anything else. Appreciate it. Thank you.